Country selection. The United Arab Emirates UAE was selected as the country of focus due to its advanced healthcare system and the availability of multiple epidemiological studies addressing dental caries and the DMFT index among children and adolescents.
Literature search strategy to identify a relevant scientific article and electronic literature search was conducted using Google Scholar. The keywords we used: oral health, dental caries, DMFT index, children and adolescents, United Arab Emirates. This search strategy aligns with internationally accepted academic research methods. The article information. Study title: Oral Health of Children and Adolescents in the United Arab Emirates. A systematic review of the past decade. The year of publication, 2022. The journal name, Frontiers in Oral Health. The authors, أمان الحداد، شيخ الحوقاني، عائشة الملة، مريم النعيمي.
This systematic review aimed to evaluate oral health status of children and adolescents in the United Arab Emirates over a 10-year period from 2010 to 2021. This study focused on dental caries prevalence, caries severity measured using the DMFT and DMFT indices, associated risk factor, parental awareness, utilization of dental services, and preventive intervention. A total 29 studies involving 43,916 participants were included. This finding revealed a high burden of dental caries despite availability of advanced dental healthcare services. The author conducted a systematic review following a structured research principle. Database used Google Scholar, inclusion criteria, studies conducted in the United Arab Emirates for children and adolescents, assessment of dental caries or DMFT index, published between 2010 and 2021. Sample size: 43,916 children and adolescents from preschool age to 18 years.
Main results: DMFT and dental caries. Dental caries prevalence range between 22% and 99.4%. High prevalence observed in clinical base studies. DMFT/DMFT findings: DMFT primary teeth up to 10.9. DMFT permanent teeth approximately 2 to 3. These findings indicate a high level of untreated dental caries, particularly in younger age group. Associated risk factors. The review identified several significant risk factors associated with increased DMFT scars: high consumption of sugary foods and beverages, inadequate toothbrushing practices, low parental education level, infrequent preventive dental visits. Conversely, regular toothbrushing and early dental visits were associated with lower DMFT scars.
Parental awareness and dental service utilization also monitor the government the actual implementation of the practices was good. Dental visits were implemented by paying or compensating condition rather than altering preventive care. The care mix was not 3 to 6%. Medication, sufficient treatment of existing caries and lesions.
The results highlight a major public health concern. Despite the availability of advanced dental services in the UAE, preventive behaviors remain inadequate. The high DMFT values suggest that oral health problems are not due to lack of access to care, but rather insufficient oral health education, delayed dental visits, and unhealthy dietary habits.
Preventive programs. School-based oral health programs were shown to be effective. One intervention demonstrated a reduction in the plaque level from 76.8 to 36.7%, that emphasizing the importance of structured preventive programs on the community level. The conclusion: dental caries remains highly prevalent among children and adolescents in the United Arab Emirates, as reflected by elevated DMFT scores. The finding underscores the urgent need for nationwide interventions, like school-based intervention and early dental visits, and the enhanced parental education to reduce the burden of oral diseases. At the end of this assignment, we hope that you will like it, and I will give you a question for discussion.
Studies indicate that high DMFT values affect not only oral health but also overall quality of life. Dental caries and tooth loss can lead to difficulties in eating, speaking, and social interaction. Additionally, these conditions may negatively impact self-esteem and psychological well-being. Therefore, reducing DMFT levels contributes to both physical and psychosocial health improvement.
DMFT as a tool for international comparison. DMFT is widely used as an international indicator to compare oral health status between different countries. Studies show that countries implementing early preventive strategies tend to have lower DMFT values compared to those focusing mainly on treatment. Such comparisons help identify gaps in oral health systems and guide improvement in national prevention.
Socioeconomic factors and DMFT. Research demonstrates a strong association between DMFT values and socioeconomic factors such as education level and income. Higher DMFT scores are often observed among population with limited access to oral health education and preventive care. The highlights in importance of addressing social inequalities when planning oral health interventions.